Hello, I'm going to go through what is required in the provider's clinical notes in order for the patient to receive a range of motion hinged knee brace. A range of motion hinged knee brace is also called a TROM. The T stands for telescopic, so telescopic range of motion knee brace. Just to start out with examples of diagnosis codes, under our non-ambulatory knee examples of medical necessity, you see 3 codes listed here. They are approved codes. However, in particular with the range of motion knee, this is going to be due to an acute case, whether a fracture, other type of injury, or a surgical intervention. As a result of that, it's hard to pinpoint what diagnoses that we would choose. And so the best practice is we will wait until the provider sends us the prescription with the diagnosis that they have chosen. We will then look up that diagnosis in order to determine whether that is a valid and approved diagnosis by the insurance. And if it is, we are good to go. And if it is not, we will find the diagnosis that closely is related to what the provider is wanting. And then we will contact the provider's office in order to let them know that this is the diagnosis that is approved versus the one that they had initially utilized. And then at that time, it would be up to them to update the prescription and the clinical notes and resend both of those to us in order for us to proceed. In the medical records, we must document that the brace was ordered because either the patient had a recent injury to the knee or a surgical procedure on the knee. With this type of knee brace, unlike the ambulatory knee braces, we do not have to show instability or an objective testing to determine the joint laxity. And the reason why that is because typically these patients are either in an immobilizer or a long leg cast. And what I mean by immobilizer is the immobilizers without the hinges on them, just a straight, soft terry cloth immobilizer or a long leg cast. I'm going to give you 2 examples here that are under our examples of medical necessity. One is for an injury and one is for a surgery. These must be verbatim put into the plan of treatment. Now, leading up to the plan of treatment, where they have this exampled statement that we have here, they can paint the picture somewhere in the middle of the documentation that can state exactly what happened as to why they have the injury or why they required the surgery. Then when we get to the example, if in fact it was an injury, it would read as follows. Patient requires, and this time we'll choose a right side, so patient requires a right range of motion hinged knee immobilizer due to the recent injury, and then they would describe the injury. An example could be, say, a patella fracture. Parameters for flexion setting on the hinged knee orthosis will be to so many degrees in flexion and in extension when the immobilizer is fit to the patient. What that means is that we have to have it stated in the notes what parameters the provider is wanting, and that is based on the healing phase. Typically when the cast is removed or that non-hinged immobilizer is removed, they do an x-ray to determine where they're at in the healing stage. And from there, they let us know prior to the fitting what degrees we need to have. Typically, it is starting out at 0 degrees of flexion and 0 degrees of extension. Occasionally, though, depending on how conservative the provider is, or again, what is reflected on the x-ray, sometimes you will see either 10 degrees or 20 degrees of flexion, but typically it's 0 degrees of extension. The TROM braces all are set in increments of 10 degrees to allow each office visit follow-up that the patient has for the doctor when they do the x-ray to determine if they can increase those flexion parameters. I'm going to read a claim that was approved by the insurance for a patient that required a TROM brace and some things that the provider stated that was valid. And it's as follows. Patient will remain in a long leg cast for 2 more weeks. Patient will require a range of motion brace in order to facilitate safe healing and graded increase in flexion over time. Current flexion and extension parameters are 0 degrees of flexion and 0 degrees of extension. It is medically necessary for the patient to immediately be put into a right range of motion brace after removal of the long leg cast. So that statement I gave is something kind of in the middle where they're kind of building up that statement till you get to the wow statement or the example under the plan of treatment. If you have any further questions, please contact our office. Thank you for your time.